3.
Welcome back to N-Powerment Nursing. I'm Linda, and this is Ashley, and you've joined us for our series, In the Know, where we make it simple. Today we're simplifying congestive heart failure.
Congestive heart failure is sometimes difficult for nursing students. There's a lot of principles around how to treat it, and a lot of rich patient teaching opportunities that we'd like to talk about today. We're going to help you simplify congestive heart failure, and we're going to kind of reframe how you might have the heart in your mind and compare it to a sump pump in a basement. And the reason why that's so brilliant is because the heart, as its job, as its mechanism, is just that. It's a pump. So what is the job of a pump? The job of a pump is to keep things flowing one way and one way only. So within our heart, and we're going to draw the natural blood flow in the heart in just a moment there and simplify that. But within our heart, it's important to understand that our oxygenated blood goes out the left side of our heart, brings oxygen to our body. Deoxygenated blood comes back into the right side of our heart. And then, of course, it goes back along a series of events until we get back to the right side of the heart. What it never does and never should do is go backwards, because the whole point of the heart is to keep it pumping forward in a one-way movement only. So the reason we compare this to a sump pump in your basement is because what happens in a pump in a basement, say for example when there's a torrential downpour, it's raining for 12 hours or even for 2 hours, but with a lot of precipitation, so 12 inches of rain in 2 hours. What you will notice if you have a basement in your house is that the sump pump in your basement is going to work harder, it's going to be pumping harder, it's going to be pumping faster, and that's to keep that water flowing, going out of the basement. If the pump can't keep up and keep pumping that water out of the basement, what happens? Do you know?
I do know.
What happens?
Your basement is wrecked.
The basement floods, right? Every homeowner's, one of their worst nightmares is to have a massive flood in their basement. So the heart behaves the same way in that if it cannot keep up with the demand of moving that fluid forward, it flows backwards and it starts flooding into places where it doesn't belong. So let's simplify that. We're going to do a quick drawing here to demonstrate the normal blood flow through the heart. So I find with students that a one-dimensional drawing of the heart makes it simpler. So here we have the right atrium and the right ventricle, the left atrium and the left ventricle, and I draw this the exact same way every single time. So here's our vena cava, and this is where we gather our deoxygenated blood from the rest of the body coming back into the heart. So this will be our start point. So when our deoxygenated blood gets back to our heart, it passes from the right atrium into the right ventricle. From the right ventricle, we go out the pulmonary artery. An easy way to remember that is that arteries take blood away from the heart every single time. Through that pulmonary artery, we get to the lungs, where we get oxygen, and we get happy. Then we go back over to the left side of the heart through the pulmonary veins. And it sounds silly, but the way to remember this is that veins bring the blood back to the heart. It's silly, but it works. We get into the left atrium, our left ventricle, and then, of course, into our aorta, A-O-R-T-A, where we get oxygen perfusion to the rest of our body, and all of our tissues stay alive and we stay happy. So this is the normal blood flow through the heart. This is how it should always happen. Now let's talk about what happens in congestive heart failure when this pump starts failing.
Well, when the pump starts to fail, the fluid goes backwards. And when it's the right side of the heart, it goes backwards to the rest of the body. And when it's the left side of the heart, it goes back into the lungs. Right? So what would be some major symptoms when we have right-sided heart failure? Well, you would see edema. You would see an enlarged spleen or liver. You would see jugular venous distension. What would happen on the left side if it backed up into the lungs? What would happen if the lungs are drowning and fluid is going into the lungs? What would be those issues? Well, you would have crackles. You would have coughing. There would be shortness of breath while you're lying down, or orthopnea.
So, what do we do then in situations for patients who have congestive heart failure? Well, we know this is a problem of fluid, right? The fluid's backed up into the basement because the pump has been failing. So if your basement floods, one of the first things you do is hope either you own a shop vac or somebody close to you owns a shop vac, and you're going to immediately start pumping that fluid out of the basement. This is what we do in the human body as well. When that heart, that pump is failing and we have this fluid backup, we need to get rid of that fluid. So we do things like administer diuretics. Lasix would be one of the number one things. And of course, when we're administering Lasix, we're going to be monitoring potassium because it also throws potassium out of the urine. We're going to be monitoring daily weights. So having the patient weigh themselves every day to make sure that fluid isn't being retained. We're concerned about plus or minus 2 pounds when it comes to daily weights. A little bit about the rules around that. Same clothes, same time of day, same scale. Does it have to be the same nurse? No, don't fall for that one. Patients are often weighing themselves at home. Sodium restricted diets, because when we retain sodium, we retain fluid. That makes it harder for that pump to keep the fluid moving forward. In terms of decreasing the workload on that pump, because that pump in the basement can't keep up with the fluid, right? So decreasing the workload of that pump that's failing, we could use things such as ACE inhibitors, digoxin, which all helps the pumping mechanism of the heart to work a little bit easier. And then a few interventions we might pay attention to as well as nurses, right? Might be elevating the head of the bed. This is one of the fastest, most effective interventions when we're talking about all of the respiratory issues Linda mentioned in terms of left-sided heart failure backing up into the lungs. And then, of course, we're concerned about oxygenation, right? Because we're getting less tissue perfusion, less oxygen to all of our organs and extremities in terms of congestive heart failure. So all of these things would become important.
For more in the know and for our concepts simplified, please check out our complete study package. Please share this and tag a friend. See you next time on In the Know.